Okay.
A very good morning to one and all present here. It gives me great pleasure to welcome you all to this webinar on depression, a slow poison engulfing the youth. Yes, we know that depression is one of the major problems that our youth faces today and somewhere fails to recognize. And this is where we run short of in saving our youth from this trap of depression. It gives me great pleasure to invite our guest for today, our guest speaker, Mr. Chris Thomas, sir. Sir is the Associate Professor of SLM Global Nursing College, a unit of Global Hospital and Research Center, Mount Abu. Sir has completed his PhD and is awaiting his results. Sir has got university first rank with distinction for MSc first and second year. He has done his training on mindfulness, gratitude therapy, systematic review and meta-analysis, research manuscript drafting and publication. He has also pursued his TOT on promotion of mental health during COVID-19. He has done his NLP beginner certificate, GCP training, and many more. Presently, Sir is the National Secretary and founder member of Clinical Nursing Research Society. He is the member of Research Committee, Ethics Committee at Global Hospital. He is the subject matter expert in metric stress services. He is the adjunct faculty for research and psychiatric nursing at many institutes. Not only academically, but Sir has also served in the bedside during the second wave of the COVID pandemic. He was involved in teletriaging, telecounseling during the second wave with Nishchay Foundation. Sir has won the best paper and poster presentation at international and national conferences and has been guest speaker at many events. He has more than 20 publications with index journals. Sir is the examiner for more than 5 universities in India. He is involved in research activities and multidisciplinary team approaches. Sir has also submitted his copyright registration for Gratitude Intervention Model Registry under the Ministry of Commerce and Industry, Government of India. We welcome you, sir, not only with your academics background, but also a man who is very down to earth and easily approachable. We are grateful for you to have you here, sir, and we are definitely sure that our students are going to gain a lot from you today. I request you, sir, to take over the session.
Thank you, Madam Arohi, and am so happy to be the part of this webinar series. First of all, I convey my thanks as well as appreciation to the university who is doing a lot. These days, Parul University is the trend in social media also and everywhere. So it's really wonderful that they are doing so much for nursing also. And Arohi ma'am, Betty ma'am, then I know Dr. Ravinder sir, and even Swapnil, who is my junior. So everywhere people are there in nursing now, we can connect to each other. So the topic, before I start, let me convey my greetings from our hospital, Global Hospital and Research Center, Mount Abu. Am I audible?
Yes, sir, you are audible, sir.
Okay. So greetings from Mount Abu, and as you know, Dalai Lama has said, na, like one small positive thought in a day can change your whole day. So before starting with the topic, I do not want to teach or something. I'm not a person who can teach well, but I can share some points which are I know about the topic which is given me, and the topic was for youth. I mean, students, right? So I hope the participants are nursing students. Mostly would be the nursing students, and other students also would be useful. It may be useful for the adolescents. We can practically what else we can done, what else we can do to our youth or our teenagers, because they are our future of our nation or country. So before beginning, let me bring a small clip. I mean, it's a picture clip, like a picture snapshot from WHO actually, because we all follow WHO for all the updates, right? So in the this is like a reference I have taken from the WHO. Like the illustrator is Matthew Johnston, who has given a wonderful story-based illustration. So this is the person is like a saying that I had a black dog. I means it could be anybody, okay, any of us could be this I. And lastly we'll see what happens. Okay, so it's just a story, maybe some of you may be aware about this. And the black dog is a metaphor. It is just a like हिंदी में हम कहते हैं कहावत. So like black dog जैसे एक metaphor है, and just an imagination, but it's like a shadow, we can say. Like how it happens here, I had a black dog, and whenever the black dog made an appearance, so the person is telling, it could be anybody, okay, whenever the black dog made an appearance to me, I always feel empty, and my life always seemed to slow down. And what happens to me if when, because this black dog always coming to me, it's surprising with me without any reason, without any occasion, irrespective of anything, this is coming to me. And the black dog made me look and feel older than my years. I am very young, but because of this black dog, I look very young, very old. When the rest of the world, they seem to be enjoying life, I could only see it through the black dog. So that is the thing कि सब लोग enjoy करते हैं, but I cannot enjoy because I can see only through the black dog. Activities that usually brought me pleasure suddenly ceased to. I used to enjoy my activities, but suddenly what happened? Because of this black dog, I am not able to. It like to ruin my appetite. I'm not feeling hunger. It chewed up my memory. I'm not able to remember anything. I'm not able to concentrate on my things. Doing anything or going anywhere with a black dog required superhuman strength. I always require strength because black dog is a block for me. At the social situations also, my confidence are getting down, people are starting judging me, I feel isolated, I feel that I am not a part of the society just because of this black dog. Because of the shame and the stigma of this black dog, I was consistently worried, like what happened to me, and I'm not able to face anybody. And maximum I try to cover up because I do not want to show the public about this black dog. It's like a stigma for me, and keeping up an emotional lie to me itself. And black dog could make me think and say negative things always to me. And even it make me irritable. Even my relationships are getting difficult. I am not able to do anything that I used to do. I used to love sleeping, but nowadays I'm not able to sleep well. My thinking are repetition. And having a black dog in my life is like that, so much about feeling. And I feel so sad, so blue in my mind at its worst even. And as I got older, this black dog is getting bigger. The size of the black dog is increasing, and he started hanging around all the time. See the difference, how the black dog became so big. Eventually, I felt totally isolated from everything, even from society, from my occupation, from my personal relations, everywhere. And finally, you people can see this, how this black dog has hijacked my life. So who is this person I? I belongs to we all. But question is, who is this black dog? I had a black dog. So who is this black dog? So the answer is, it is depression. So the simple thing is how the people, we all have this black dog, we all have this shadow with us, with a suffering shadow, and we are not able to focus, or we are not able to concentrate, or we are not able to work with it. So as the year goes, as the time goes up, the black dog is also getting bigger. So as we all know, I'm not going to take more on this subject because it is there very well. It is written in the psychiatric books and all, no, about depression, about the disorders, all those psychiatric disorders. So it's available. But the point is, why this topic is very current or very real these days, because even the UNICEF has also has reported recently, like in 1 in 7 Indians between the age, you see the age group 15 to 24 years of age, people feel depressed and they lack interest in doing the things. And you see the news paper cuttings. Just I'm remembering, recently I have watched a movie. It's in regional language, but it can be watched by anybody because the subtitles are also given. So in that movie, I'm not promoting the movie, but I'm just telling the fact, what they have said. It is about the students and the college, like a university. So they are finding that in that story, I mean, in the story, it could be fiction, but somewhere it's like an eye opener for everybody, like it was telling in a year 53 students died because of suicide in that university in a year. And nobody is questioning because of the high profile people, all those things, it is not coming outside. But the fact, somebody is questioning them, how it could be. That is, the story goes like that. But the main important point is why students are doing, what is the reason. So it is like there is like every day we can say one or two students getting into suicide, or it's not only students, youngsters, especially middle adulthood. Even the news Times of India also responded, like when they did some study during the lockdown period, also they found like age group between 16 to 20 as well as 21 to 40. You can see in the graph like how it is like 33% were depression. That this orange color is depression, then this green is about anxiety, and the gray color is stress. And stress itself is a cause of depression, we all know. So you can see the difference ना, like 20 to 40 years में सबसे ज्यादा depression होता है comparatively to other age groups. Even 60 plus also very less, only the stress factors. And this is only out of 891. Those so during the, especially during the youth period, the youth people during the lockdown period. Even many studies are there. Even the prevalence also depression, according to another graph study done in Bihar, and they found also depression in the age group like 14, 15, 16, 17, 18. मतलब teenagers में बढ़ते जाता है. And as like you can see, the maximum people are suffering with the depression only. Like normal people, you can see the red color belongs to the depression, mild depression, then moderate and severe. So you can see the how the graph is the spike, you can see now how it is increasing now, like the wave. You can see the bar diagram. So we all do studies, many studies are there, depression, anxiety, stress, but the study करके मतलब नहीं है. What intervention we can do by self. Actually मेरा मतलब ये है कि when the students can do by themselves, self help, that is the most important thing na? To rather going somewhere else or getting treatment. First of all, you should help yourself, so then only you can go to others. So this is the reality, the basic reality of this depression. And the topic is like a slow poison, right? Yes, it is a slow poison. Like we know, we all take foods, we all have daily our routine में कहीं ना कहीं पॉइसन तो रहता ही हमारा फूड, अगर पैक्ड फूड है, even the food preservative, all are small या very minute poisons would be there. फिर एक दिन ऐसा आएगा कि it will become like a big issue for our health physically, I'm telling. Same way depression is a mental disorder, or we can say it's a mental phenomenon, we can say, where there is persistently the sad, it is like a situation based, and they aren't able to enjoy their situations which they used to do, which was rewarding for them. If any pleasurable activity, that is known as, in term in psychiatry, it is known as anhedonia. So anhedonia, like a lack of pleasure in an event, where the pleasure in a pleasurable event actually. So it's a leading cause of disability. WHO already has been said कि आने वाले समय, already it is being reached, is reached already, like depression would be the major disease. Previously it was like a symptom only, and in the American Psychiatric Association, even the DSM criteria, even the ICD, now ICD-11 has also come now, so they all are telling major depressive disorder, then different types of depression, all those things you can read from your psychiatric books. But बात यह है कि how it would become a slow poison when we are not able to controlling ourselves, we are not able to manage by ourselves, it will become like bigger. In the my first slide I shown you about the black dog as the WHO has illustrated na, though it is a metaphor, but आप थोड़ा उसके बारे में थोड़ा deeply आप सोचोगे, so you will understand really it is like our shadow, that depressive shadow which we are trying to hide, that will become bigger and bigger and bigger. So the stress happens. Stress सबको होता है, but exactly stress is a learned phenomenon, I must say, because we have learned if it is an exam we should take stress. It is learned, we have learned that, we are conditioned to that actually na. Like if I am having presentation today, so I may have little bit stress to prepare, to present, or to think about the audience, how it would be conveyed. So the situations which you are not able to manage by yourselves become your problem, and that will create a negativity in your mind. That is why we aren't able to face, that is your fear. And that wild fear get bigger into bigger and bigger in your subconscious mind, become your worry, and that worry will become a pressure for you. That pressure is the stress, and this effect of this stress on your body is called as strain. So mind ka jo stress, mind ka jo pressure hai, stress hai, and that become changes in your body, and of course that is bringing in your body or in your mind a tension, right? So this is very important to know how this process happens in your mind. Etiology, again it is a bookish part, like a causative factor. Generally psychiatrists say there, or in the psychiatry we learned, we know that it is idiopathic, or sometimes there is no exact cause for this, the psychiatric, there are various theories. But apart from that, if we though believe in the theories, some theories are very true also, we should accept those theories, we must believe in that. Like genetic factor, if you must say, like maybe 5 out of 1 in 5 may affect in the family. Familial tendencies must have, even the monozygotic twins have more chances rather than the dizygotic twins. First degree relatives have more chances to get into psychiatric disorder. Generally if we speak now, we can causative factor को हमेशा we can दो तरीके से हम दिखा सकते हैं, like a body or the environment. So body में physically क्या क्या हो सकता है, like even the biochemically we know, like deficiencies of our neurotransmitters, you know, all those actions of our neurotransmitters, like a dopamine, especially dopamine works for your attention, your concentration, your aggression, your mood, your thinking. So those things gets less in this patient, deficiency. And norepinephrine always work with stress. When you are in a stress, it will mediate that. Because as the stress hormone gets increased, like cortisol gets increased, definitely the norepinephrine level gets imbalanced in your body. So definitely that stress can also lead to depression. Serotonin is also another important this for your memory, for your sleep, or anxiety. So serotonin ka bhi deficiency होता है. So these days acetylcholine also has been found, deficiency of this acetylcholine also, imbalance of this acetylcholine also can lead to depression. Another important thing, this is very very important point, ki secondary depression. So secondary depression क्यों होता है, like because of any other conditions, or because of some other comorbidity it could happen, or some other illness, or maybe because of side effect of something. I will tell about this in the treatment part also. Something I would like to share you some data, like some drugs can cause depression. Maybe the antipsychotic, psychiatric drugs itself can cause depression. Antipsychotic drugs can cause depression because they are blocking the dopamine. Of course, the dopamine level getting into less, the D2 receptors getting blocked. So definitely there may be chances to have the patient into go into like a depression, or maybe the person is getting into cancer or heart disease or any other disorders, maybe the hormonal disturbances, GI disturbances. They may not feel happy, and they may feel sad, pessimist, and of course they may go land up into depression. That is secondary depression because of something else, no other causes. Then some theories, Sigmund Freud. We all believe in psychiatry that Sigmund Freud's theory, because very rarely we could see the new theories in psychiatry. Theories are coming, but the basic theories are the same only, na? Like psychoanalytical theory, psychosexual theory given by the Sigmund Freud. In the psychology, we have learned this. But psychoanalytical theory भी यही कहता है, like hostility, खुद के ऊपर गुस्सा, anger turned inside, or the loss, something loss, object loss theory भी यही कहता है. Like if in your childhood itself, if we had lost somebody, so definitely the people may feel that in their adulthood or in the teenage life also, they always feel lost, or conflict, inner conflict or something like that. And the cognitive distortions, the Beck has also given some theory about the cognitive. In the in the cognitive behavior therapy also it is mentioned actually, like negative expectations. Means maximum problem हमारे साथ क्यों होता है, why we face problems in our life, just because of expectations, right? We expect a lot, and we want as we expect, we want everything as we expect, कि जैसे हम expect करते, उम्मीद करते हैं, वैसे हमारे साथ होना चाहिए. So this expectation sometimes not fulfilling, so that become a negative, it become a cognitive or cognition component if your mind gets disturbed, right? Like negative expectations of the self, negative expectations about the future, or negative expectation of your environment, your society, and the various life events also, you can say. Like life events means any stressor events, maybe lost, already I told you, like somebody has been lost, or any physical damage to your body can cause into, or if you failed in something, you lose your job, or the marital disharmony, or the parents conflict, interpersonal relationship getting disturbed, this all can cause. Because why I am telling about this fact, when you're getting a patient, because maximum of my delegates would be the health professionals, right? So when you get a patient, rather starting the treatment, we should identify the precipitating factor, right? Precipitating stressor, what exactly bothering them, what exactly troubling them. So this is just like a reality, because we should rather more bookish, we should go something practically also, कि reality में भी कुछ चीजें होता है जो books में नहीं मिलेगा आपको. So like for example, academic stress in adolescence में ही होता है, pressure, academic pressure, they have study time. Why this is happening, I'm not blaming any university or any college, or our system, educational system is also in that such a way. This is true, but even the foreign countries का जो education system और Indian system में बहुत फर्क है. Their system, they have the mental health is also part of their educational curriculum, but here we are learning this mental health only in our medical education. But these days now, this new educational policy has come, NEP 2020. Many of the states have implemented it, so they have in the curriculum, they have given very emphasis on mental health. We should start teaching about mental health, like in biology, how we are teaching about all our health, the physical part. Why we are not teaching mental health to our school students? So वही से academic stress का जो कहानी वही से शुरू होता है ना. So that stress, even parents are also giving more stress to the students na. So they also feel like how we can that pressure, maybe the comparison, this will, like we all know, like competition is increasing, so we can have more, students are going into in that part ना, like parents का pressure है. कितने बार भी आप तारे जमीन पर देखो या थ्री इडियट्स देखो, all those are like only fun for us, but उसका जो मैसेज थे कोई फॉलो नहीं करते, because still उसमें बताया हुआ है ना कि we should not give more stress. Then after that, peer pressure is also there, can go into depression, because these days social media is the biggest platform, right? पिछले 2 साल से सबसे ज्यादा जो ट्रेंडी है सोशल मीडिया, लाइक इंस्टाग्राम है, ट्विटर है, फेसबुक है, और भी बहुत सारे होंगे जो टेक्नो savvy people may know, because people are technologically very much high, especially the teenagers. So they want more their post, in their post they want more, like they may see how many likes they got, who have been liked them, who have given which type of emojis to them, which type of symbols to them. So they want this become a pressure for them. और अगर कोई रील्स बनाता है तो कितना लोग उसको लाइक करते हैं, किस टाइप का रील मुझे बनाएंगे तो आई विल गेट मोर लाइक्स. So they may go into like vulgarity also sometimes, or which is not decent for society, socially decent नहीं है वो भी चीज सोशल मीडिया में पोस्ट करते हैं, तो become because of just peer pressure. और another है interpersonally we can say romantic issues. This is a normal thing because sexual orientation के बाद जो stages है, genital stage यही कहता है in the psychosexual stage ना, they have that attraction towards opposite sexual attraction होता है, they have mate formation, we cannot stop them, it is natural, it is normal. But the thing is the studies have many research studies, you can even search that ki 80 to 90% studies shows that ki the romantic issues or romantic relationships in the peer, I mean in the among the peer group or in the adolescents or the young adults or in the early adulthood are failure only. And because they don't know exactly what is love, what is lust, and what is attraction. So the difference between love, lust, and attraction, students are not able to identify. They're just for time pass, and sometimes they take it as very serious, or it may go into depression. ट्रॉमेटिक इवेंट्स भी अगर कुछ लाइफ में हो जाते तो दैट बिकम ए पोस्ट ट्रॉमेटिक स्ट्रेस डिसऑर्डर आफ्टर सम ट्रॉमा और समथिंग हैपेंड टू देयर लाइफ, मे बी somebody has abused them, rape attempt हो गया, या कोई भी physically also happen, some accident or say have lost something, and after that also they are in that stage. So that event they are not forgetting, memory में वो रहता है, so that become a greater stressor for them. Emotional neglect. Emotionally, if somebody is neglecting their child, maybe they are not supporting their child, parents are away, parents are not taking care of child, uh, that child can become because of that they become land up into various disorders, like then physically appearance. These days people are very much bothered about physical appearance, तभी psychiatric में anorexia nervosa, bulimia nervosa cases बहुत ज्यादा बढ़ रहा है because of this, because I am not looking good, I am beautiful, I am ugly, I am fat, I am thin. In the school time we used to study like difference between beautiful and ugly. Actually these things should be actually removed, or this should the examples उस समय जो examples हम पढ़ते थे, she is very beautiful person and that boy is very ugly. So पहले से दिमाग में मतलब बचपन से डाला हुआ है ना कि ब्यूटीफुल एक होता है, अगली होता है, but rather telling something, why they are pointing to something to a person, rather something else they can say na, beautiful object, beautiful place or something like that. So same way physically they are taking more, they are more body conscious, so not eating well, they're giving more importance to that. Then addiction, another issue. See, I cannot say anybody, I cannot judge anybody, you should not take this, you should take this, we cannot judge anybody, it is our perspective. Actually there should not be proper actual judgment should not be na, this is right, this is wrong, or ye wo, because our perspective actually allows us to judge na. So anyway, but the harmful things can also, because they feel that they are not able to control themselves, so they go into such things, addiction, substance abuse, or even internet addictions are these days. In the ICD-11 they have added this internet addiction also. You can see ICD-11 criteria which we have updated now, so revised criteria. Addiction disorders ke andar along the substance, this internet addiction, gambling, these things are very highly issuable है these days. Addictions, प्लेइंग ऑनलाइन पॉकर गेम, अभी भी जूम लाइन में काफी लोग स्टूडेंट्स देख रहा होगा, एट द सेम टाइम उनका दूसरा भी पेज खुला होता है कि दे आर डूइंग दूसरा this type of games or online, so they become an addiction. एक टाइम में था ना ब्लू व्हेल सुइसाइड, अगर आपने सुना होगा, so now it is not there, so something else has come. So these things we should give more awareness. Actually awareness जैसे से create करते with suitable examples, some live streams ना, we can give we can control somewhere, and that is why stress also become a part of this reality. सो डिप्रेशन का जो साइंस जब एडोलेसेंस में होता है कि चाइल्ड, यू कैन आस्क योर पेरेंट्स, यू कैन आस्क योर टीच द पेरेंट्स, यू कैन टीच योर पब्लिक. सी पब्लिक हेल्थ इज must actually, it should be a part of our curriculum. Public को हमें सिखाना है. We should go to the public level and grassroots level itself to teach, whether their child, whether their adolescent, whether their family member, anybody is following any of these symptoms, not enjoying the things, emotionally drained or generally sad, hopeless. I feel no hope today. Some people may say. Many researchers have been, then have not put here because because of time constraint, and qualitative studies when we do na, like because I am very much interested for qualitative type of studies also. So I have read some article and how the adolescents have responded na, about their verbatim, I mean to say the verbatim were like that: I feel so hopeless, I am not feeling any hope in my future, I don't think so I will get a government job. Because people are totally pressurized. The society has pressurized with the students or the pub or the maybe the society, family, peer, like you should have a government job, tabhi aapka shadi hoga. This is like some culture, some people, many of my students used to tell me, sir hamara shadi nahi ho raha hai because my the parents want government job. Yes, people want government job for the financial security and many advantages are there. But I'm not against for anything. I'm not against for private or against for government or anything. What I am saying, the what we are teaching to them. Exactly. So they feel hopeless. If they fail, they feel hopeless, hollow feeling, useless feeling, and of course that mind reaction will convert your body. Lethargic, sleepless, headache. We all feel na headache. अगर थोड़ा सा stress आ जाता है तो headache हो जाता है हमें. And the thing is sometimes behaviorally, immediately irritate होना, disagreeing, avoiding social interaction, skipping the school, abusing with the drug abuse, cognitively also they aren't able to finish it. So being a teacher, if I want to suggest our teachers also, those who are attending this, or definitely you should observe the changes. It is not like that only psychiatric people can observe, anyone can observe. Any changes is observable in your students, or the students also. You should see your peer group, any of your family member, any of your peer group is getting into these symptoms at least for 2 weeks, minimum 2 weeks कहता है. और some criteria भी है, और भी criteria है. So that time period, that frequency is very important for how many time they are taking into this na. Maybe they are not able to consistent in the school, what type of counseling they should get, why they are not able to take the decisions, what exact problem they're facing. So those signs first we have to observe, then we have to identify the trigger what happening. So other warning signs are also there na. Depression can go into suicide risk. It's a potential problem. Not all the depressive patients are suicide. We cannot say all the depressive patients are suicidal or they may do suicide, but symptoms have to be identified. Any cues you have to see in among yourselves, your students, your friends, or your peer groups, so we can say like how we can go into that. This is given in the book also, like direct cues also you can give, like patient directly telling about the suicide, like I want to die, I'm going to kill myself. So this is directly they may give about the clue. But some people they may not give direct, like indirectly bhi hota hai, disguised, hidden एक agenda होता है, like indirectly. अच्छा मेरा सारे प्रॉब्लम खत्म हो चुका है, this is the last time you are going to see me, I am not going to come tomorrow, my work has been done. So indirectly clue देते हैं, या फिर directly behavioral clues भी होता है sometimes ना, behaviorally also non verbally sometimes the people may writing their possessions to something, giving gift to others. Depressive patients suddenly become active, suddenly active हो गया तो भी they become getting more energy, that itself is a clue for the suicide. So you should not say कि only depression phase में वो suicide करेंगे. When they become in the active form also, it's a clue for suicide. So suicidal attack को prevent करने के लिए हमारे पास बहुत कुछ options है. So these criteria are given in the books. I have just tell you, I'm not going to read much, but major depressive disorders also have been listed. Now this is DSM-4 TR. Even DSM-5 revision has also been come. This is the DSM Diagnostic Statistical Manual for the chapter. In that third revision they have given, like insomnia. As pehle, when we were student, we used to study DSM, I think 3 or ICD 10, 9 to 9 and 10 ना, उसमें ये लिखा, I think, I'm not sure, I'm not, sorry if I'm not sure, like sometimes na, like people only had insomnia, But these days we can say ना insomnia भी होते, hypersomnia, they feel more sleepy. Previously ऐसा होता था, they may feel hungry, they may not eat well, but these days we can say people want to eat more in depression phase. They gain weight, they lose weight. So any of the symptoms, at least for a 2 week period, if it is coming, definitely psychomotor retarded, anxiety, diminished in their activity, concentration lose हो जाता है, low energy, low self-esteem, recurrently planning of suicide. Those are speaking about, telling about suicide will not die. This is a myth. प्लीज अंडरस्टैंड, इज ए मिथ. पीपल मे थिंक दैट दो सुइसाइड के बारे में बात करता है वो कभी नहीं मरता, ऐसा कुछ नहीं है. इट्स अ फैक्ट. ऐसा है कि मेनी पीपल दोस आर गिविंग द वर्ड्स, दे डू suicide. So we should understand those things. Now coming to the management, in the book part we know about the antidepressant. You can see the graphically also how the severity goes and the time period, and this is for major depressive disorders na. Various types are there: psychotic are there, neurotic are there, exogenous, endogenous, and secondary depressions is there. Major depressive disorders are there, seasonal depressions are there, acyclic. So many type of depression. If you see, if you read Kaplan and all, you will get many types of repression. The graph itself is show the acute phase for 6 to 12 weeks, the treatment goes, and then again continuous phase it will go. Otherwise, there is chance of recurrence, because sometimes we see if the any side effects could occur, the person may stop, so they will not continue the treatment. Again, the relapse and the recurrence phase will happen. So you should always understand how to maintain the treatment. You should understand. But the बात ये है कि in the etiological factor, मैंने एक point बताया था आपको about the side effect of the drugs, right? Recently, I had watched some video or something, some article I have read actually about a person, a doctor, Dr. Grace Elizabeth Jackson, who is a MD psychiatrist in US. Very before, I think 10, 12 years before only she did, she worked on that. She wrote a book actually. The book name is Drug-Induced Dementia, A Perfect Crime. I have not read completely. It is available in Amazon and Flipkart. I have to see, but some article on that or some pages or some YouTube videos and also I could see, because when I got some interest in that. So I'm just telling the real fact. Drug-induced dementia, a perfect crime to the humankind. Humankind के लिए अब crime है, एक drug induced, मतलब drug के वजह dementia पे जाता है. And that is side effect of the psychiatric drug, antidepressant. She more focused on antidepressants, antipsychotic. And you know what happened to that? She has given various classes on that, and she said like people are like the brain changes. They have done brain studies on all those things. The brain changes has happened, like the MRI, CT scan, all those study images, and they have worked on many patients. They took a good number of samples also, and they found that the brain size is getting shrink हो जाता है, squeeze हो जाता है, sulci and gyri especially. And the what she's telling, like antidepressants, we know antidepressants का main action होता है to block the reuptake of the inhibitors, na, serotonin, dopamine, or reuptake of this enzymes, especially serotonin, dopamine और norepinephrine का reuptake को block करना है ताकि उसका level तो बढ़ाया जाए. So they are telling this depression is a disorder related to your mind, of course, and how a chemical can cure the mind. So that is her question. And she has been, I think she has been removed from her job also, because this was a question to many psychiatrists. I don't know if any psychiatrist is seeing this, they may question me, because I am not a right person to tell about more about this, because I have not studied much about this. उसके पीछे मैं ज़्यादा study किया नहीं है, but it's interesting and it's an eye opener for everybody. कि along psychiatric drugs alone cannot cure. She was telling, she was comparing na with a lollipop. You know the lollipop na, that sweet with a stick. So we stood up, children's like lollipop is very sweet. So she was comparing our brain is like that today. That outer cover is like the lollipop ka jo outer part hai, that is like a cerebral cortex, and the sweet part inside the middle part, it's like our subcortex, and the stick of lollipop ka jo stick hai, that is the brain stem. So how it is like a dhire dhire am lollipop, when we are like when you are having the lollipop, dhire 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 wo kam hote hote jata hai na size. The same way she was expressing that the brain require more, because and this will go into Alzheimer's, and Alzheimer's will cause dementia. So side effects to hey, but the point is, along with the antidepressant, there should be some supportive therapy, and that is the major part. If the person is in a mild or moderate depression, start with the supportive psychotherapies, any form of therapies, behavioral group therapy. These days there are many therapies, new therapies we can see for the psychiatric patient, even in the mental health issues, any mental health issues, any soft skill trainings are also available, where we can increase the confidence, increase the perseverance, communication, determination, many things, empathy, all those things. Soft skill training is very important in the college. It must have, students must get soft skill training. Or cognitive behavioral therapy is also very important. I'm not going into detail about these therapies because it is like a psychological part. We can also do, there are various courses available, even the online offline also we can try to do, and we can implement. मेन पार्ट है हम कैसे इसको अप्लाई करते हैं. सो अलोंग विद दिस अदर ईसीटी, अगर अब आप शॉक ईसीटी भी देना चाहते हो पेशेंट को, ईसीटी कैन बी गिवन ट्वाइस इन ए वीक, ट्राइस इन ए वीक फॉर 6 to 8 ईसीटीज आर देयर. ईसीटी का सबसे मेजर इंडिकेशन है सीवियर डिप्रेशन. बट द बात यह है कि दैट अलोन कैनॉट वर्क. So these other therapies will work. So I am just bringing back our black dog here. You have seen about the black dog. Those who have not seen that first slides, you can watch again and you can understand. This is a WHO का the same point है कि WHO ने जो illustrate किया वो story है about the black dog and what happened to that eye. So in the story, it was like the eye that person had completely hijacked with the black dog. That black dog is depression, right? So the thankfully, finally, what he said, I finally thought to go for some professional help. The person, this was my first step towards my recovery. I thought that I should do something for myself. I learned that it doesn't matter who you are. The matter is the what, how the dog is affecting, because that black dog is affecting millions and millions of people. And I learned that there is no any magic to cure my depression or cure my or reduce the size of my black dog. Or like if you take this silver bullet or magic pill, I will get cure. Medication can help. At the same time, there should be some other approach. So that's why I'm telling medication. I'm not telling that madam has said like it is a side effect ये है no doubt, but the thing is उसके साथ हम क्या और दे सकते हैं. मतलब मेडिकेशन से भी ज्यादा काम जो आपके थेरापी some approaches will do. And he learned that कि emotionally genuine and authentic, emotionally genuine and authentic to those who are close to you, very much discuss with them. That is the absolutely game changer when we are discussing with others. I started I learned not to be afraid of the black dog because मैंने खुद का कुछ tricks ढूंढ लिया where I can work on myself. So it has been clinically also proven, clinically bhi this is proven that we can reduce depression. We can do regular exercise. How many of us do regular exercise? Then it can be as effective for treating mild to moderate depression along with the antidepressant, because this is another topic actually. Antidepressant itself, it's whether it should be go or should not go. If it is against some psychiatrist, then what psychiatrist will do, what psychiatric nurse will do, that is another big topic. But again, I'm telling, this is like our part. Even you can start writing something about our mood daily, if you're writing journaling or something insightful, keeping grateful journal. I will tell something about this in my further slides. Only few slides are left. And if you take the right steps, talk to the right people, धीरे धीरे black dog will come down. धीरे धीरे वो कम हो जाएगा. It will, the day will come where the black dog, and rather what I should do, I should start learning to accept it. I had a black dog. I have a black dog. I may have also in future also this black dog. That's a shadow, that depression. I should accept this. I should accept as I should embrace. I should hold it. Right. So that is the way the story goes. And this is very true factor. Na? We all know stress man. अगर मैंने कोई student से भी अगर पूछा, what are the stress management? They may give many advice to me. If I ask to anybody, we can give advice to many, but the thing is how much we are able to follow or how much we are able to manage our body and mind together. There should not be that imbalance, right? So that positive steps has to be like how we can be creative. अगर जो काम हमें पसंद है वो हमें करना चाहिए है. That is the first things. So we must get involved in those activities, or we can give our words. Sometimes our words itself, रोज किसी से झगड़ा करना ये सब करके कोई फायदा तो है ही नहीं ना. सो एटलीस्ट यू शुड एबल टू फॉरगिव अदर्स. फॉरगिवनेस, आर्ट ऑफ फॉरगिवनेस इज अ वेरी इंपॉर्टेंट टॉपिक एक्चुअली ना, आर्ट ऑफ फॉरगिवनेस. सो ट्राई मैक्सिमम, ट्राई कोशिश करो हाउ वी कैन फॉरगिव अदर्स और रिएक्ट. यार रिएक्ट करके हम हाउ वी आर रेस्पॉन्डिंग एंड रिएक्टिंग इज डिफरेंट, राइट? सो आवर टाइम, समटाइम्स आवर टाइम, आवर वर्ड्स, आवर प्रेजेंस कैन क्योर many, or maybe that simple things you can notice, or the other thing, these are like home tips we can take. You all know, I know well, because ये सब कुछ available है online में. मेरा class का भी जरूरत नहीं है, and I'm not such a person who can teach you very good thing, but I can give some tips or some things which I also follow, or where I could see many are following. You should feel connected. So students, I just though it is not an interaction session, but just I want to ask you how, what it means, that feeling connection. How we can connect to others, no? Like आज के तारीख में we can connect with anybody. There we no need to anything, because we came up in such a area, we come up in such a part of our life, like minimalist. Minimalist मतलब minimal things से हम जी सकते हैं. If I am staying in a small room, suppose if I am staying in a room with the minimal things, I can survive with minimum amount of cash, with the minimum amount of resources, maybe like small, like smartphone, और एक छोटा रूम, ऐसे मतलब एक दो बुक्स और कुछ छोटे छोटे चीज है तो मेरे पास, आई कैन मिनिमलाइज माई सेल्फ एंड आई कैन लीव वेरी गुड. सो बिकॉज एवरीथिंग इज कनेक्टेड टू ईच अदर. अगर मुझे किस टाइप का खाना चाहिए, आई कैन इमीडिएटली ऑर्डर थ्रू माई phone, through my internet. The connectivity. So are we connecting to the right person, right media, right platform? This is very much careful. You have seen many movies or many advertisements about the social media traps, trap behind various social medias, various trap. बहुत ज्यादा ट्रैप होता है सोशल मीडिया के चक्कर में, बट उसमें जाने से पहले हमें उसका नॉलेज गेन करना चाहिए. And we should take some positive. I am not against, I am also a good follower of many things, Facebook, Instagram. I also, my family also do, I also put reels and all, but many things learning, still I am learning because I don't know exactly. But youngsters, now you people can learn many good new things about technically how we can survive, how we can connect. Recently I have connected with something like called as Clubhouse. शायद किसी किसी को पता होगा या कोई हो भी रहा होगा उसके अंदर. Clubhouse, it's a, like an app you can download. It's Clubhouse, and उसमें ना you can select anything like health, humanity, spirituality, religion, sports, sex, adolescence, or children's, youth, regional language. Many things are there for you can search your area of interest, and daily you will get some or other. Every hourly, every time, some or other people are talking about. Matlab people are discussing. Even we can also be part of that discussion, like in how radio FM we talk now in the same way. So we can learn many things when you are connecting with the different people. We should connect with other people, other our professional people also. It is not like that only with the nursing, only with the medical people I will be friendly. We should connect with the interdisciplinary, with engineer. You should have all sort of group with you, so there be a good discussion, good thing, area of interest के हिसाब से. So ऐसे applications available है where we can connect ourselves. This is a advantage. Disadvantage भी होंगे, I do not want to tell about that, but just focus on that positive aspect of that. So many things are there in Instagram है कोई भी. तो I'm not telling about any dating site, you have to date somebody or those things. ऐसा भी है I think, but the बात ये है कि how we are connecting, how much serious we are, and what we are learning from that. Keep learning. That's the thing. New experience always teach you. Don't miss any opportunities whenever you're getting to learn something. You should only find the resources for you. So students, if the students are attending, please, especially nursing students अगर attend कर रहे इसमें, don't make a simple motto like only my aim is to achieve government job. मुझे सिर्फ government job चाहिए, या मुझे सिर्फ foreign जाना है, या मुझे सिर्फ पैसा कमाना है. You should try to be like understand what are the opportunities, what are the various things where you can do. That is a career opportunity actually. eat well, live well, you all know well, because you all know खाना तो क्या खाना चाहिए, कैसे खाना चाहिए. And exercise, exercise is a very important part of our body, right? And how many of you do exercise daily? Exercise in the at least for daily walk. अगर आप डेली वॉक करते हैं तो माइंडफुलनेस, मतलब माइंडफुलनेस इज द इम्पोर्टेंट पार्ट इन दैट. Mindfulness means how much you are connected ourselves with the work we are doing. That is mindfulness. So for example, this is like another big topic. I also not done many courses, or many courses are also available. But as far as I know, like wherever, whatever we do, we can put mindful in that. Like for example, if I am going for daily walking, I can be a mindfulness walking. Like I have to think about like my walking, my style, my legs, my arms, my body, body is getting blood circulation, like that. या फिर आप like cooking, अगर if you're doing a cooking, mindfulness cooking, so that energy will transfer. So many things are there where what a mindfulness study, putting completely on that, definitely. If I mindfulness teaching, mindfulness reading, so these things definitely. And exercise is very important. We should able to balance our work and the life, I mean personal and the professional life, non mix that. Sleep well. Yes, student have no issue, I think so. Okay, they are getting very less sleep hours or those things. These days students get go more time to sleep, but still it should not be like a hypersomnia also. At least 6 to 8 hours an adult must sleep. Getting into sleep is very important, right? And connect to the nature. हाउ वी आर कनेक्टिंग. जैसे कोई वेकेशन आता है तो पेरेंट्स प्लान करते हैं टूर का, नहीं वेकेशन. आई विल टेक माई फैमिली टू न्यूयॉर्क, आई विल टेक माई फैमिली टू न्यूजीलैंड, आई विल टेक माई फैमिली टू दोस्त. बट in your package, in your tour package, there should be something related to nature. At least for 1 day, 2 day, have a visit with your children or have a visit among yourself also. अगर आप student भी अगर कोई टूर वूर जा रहा है, risky adventurous trip वगैरह, so definitely that should be connected with the nature also, where we can learn many things like forest है, water है, या air है, where at least plants, flowers. ऐसा कोई जगह जाओ जहाँ आपको free air, free oxygen, सब कुछ मिलता है. So when you are connecting to that, no, definitely there will be some changes in our mind. That mind will become more cool. And getting help. Never ever ignore that I should not get help. I should get help. Never ever get into that habit that ki I should not ask. या मैं किसी से पूछा तो what I will, they will respond. So that very important. Reading is an important skill. Try to read. अगर आपको time नहीं मिलता है read करने के लिए, because sometimes students may tell I have so much to read in my curriculum. So at least you should download some audio books. Audio books are also available. So when you are sleeping, when you are walking, when you are traveling, just listen. Various applications, softwares are, I mean this or this applications are there. Storytel hai, Amazon के अंदर है, Kindle है. तो बहुत सारा ऐसा है कि where you can listen audiobooks, stories, novels, anything, any sort of things. Just so reading is also a good habit where we can try to embrace ourselves, try to get more knowledge, as well as we can apply ourselves. And always think only to earn money is not the this is a part of survival only. Just earning money is not the survival, na? So earn sufficient money to live comfortable, but don't live only to earn money. You have to enjoy. And last point I would like to emphasize is about the gratitude also. It's because there are many studies on the gratitude and the depression. I have done my PhD on this, and still I am learning many things about, because this therapy is there. Intervention, gratitude intervention is a therapy, and first सबसे पहले हमको खुद के ऊपर अप्लाई करके देखना है. And I did at least for 1 or 2 years on उसके पीछे. Then I prepared along with my guide. I should thank my guide for guiding me. And again, my students were my samples, because those times corona ke time the to patients were not available. So I did on my students, and the students were able to practice this. But the thing is, in our life, the main problem is we are just learning something new and we do, but we do not have a consistency in that practice. That consistency is lacking. So journaling can help. Journaling means writing, gratefulness. Daily, if you're writing, this is a biggest topic, bigger topic, researchable topic, and definitely it can be applied anywhere. So, madam, I know only 5 minutes are left now. Definitely, I will complete. So, being grateful, that will become a happier na. Problems go, suppose if I am getting into anxious, I am also trying also, I cannot say I am a successful in that, still learning, still trying. My students or my parents or my friends, wherever I could learn, I am learning, and I am trying actually. And my because we all, not only me, we all have learned na about the gratitude, saying thank you. जैसे अगर मेरा अभी जैसे क्लास ये खत्म हो जाएगा, then Arohi ma'am will say thank you. That is the normal word of thanks देना. This is a normal thing. But the बात ये है कि how much we are recognizing ourselves, and how much we are identifying these things. Identifying oneself with the gratitude is very important. If somebody has helped me, definitely it is not meaning that मेरा हिसाब है उसके साथ, तो I should help him. I may help somebody else, not to the same person. So how I am getting into connecting to that is very important. So gratitude, if I start quoting, see how much things, if it's like a clouded way it is shared na cloud, so you can say how much things, these are things which we did in our practical classes also. And I could say that when I started, students were telling sir हमें ये problem है, ये problem है. मतलब अगर हम दो टाइप का एक कार्टून देखा था मैंने, some image like it's like image but it's really a brainstorming image था मेरे लिए. Like एक सेशन कंप्लेंट था, आई कुड नॉट पुट हियर एक्चुअली, आई फॉरगॉट एक्चुअली. एक जगह कंप्लेंट था, एक जगह ग्रेटिट्यूड था. तो कंप्लेंट्स के जगह एक लंबा क्यू था, लंबे मतलब पीपल वर स्टैंडिंग इन ए बिग क्यू, एंड द ग्रेटिट्यूड के प्लेस में नोबडी वर स्टैंडिंग. एंड दिस इज द लाइफ, वी ऑल हैव कंप्लेंट्स ना, हम सबको कंप्लेंट्स का लिस्ट बहुत जाता है. where our thanking list, gratefulness list. So many studies are there which proving that mild depression, anxiety, stress, or having a mindfulness, gratefulness toward ourselves can cure anything. If I am thankful to this team who are invited me, or I am thankful, how much that is, just saying thanks doesn't matter. We all know, we all say thanks, we have learned that. But how we are identifying oneself, then I am thankful to the internet, I am thankful to the laptop, I am thankful to the Zoom, I am thank, many things are there not to thank around. If you see everywhere there is something or other, there is thankfulness no. So that is why energy, that University of California, they have found one study na, like energy, we have learned in physics na, energy can neither be created nor be destroyed, but the thing is energy can always be transferred, right? So law of attraction always says where the energy goes, there our that area, our attraction also will be going. So what they are telling ki energy should go in a positive way. Their study proof in the research, like sometimes people, today morning when I was taking class, so I just asked somebody, are you confident? So students said yes, I am confident sir. So I said, in what sense you are confident? Yeah, I'm confident that I will pass my university exam. So I said, so I always tell the students, don't study just for exam, don't study for university exam. University mein pass or fail ho, that is not the matter. What you are learning, that knowledge matter. So he is saying that I do not want to fail. इंस्टा वन इन मतलब आप नेगेटिवली नहीं बोल, मतलब मैक्सिमम कोशिश करो. आई एम ऑल्सो नॉट टेलिंग कि मैं सब कुछ कोशिश करता हूँ, ये सब कर रहा हूँ, बट आई एम जस्ट टेलिंग द फैक्ट. द नेगेटिवली हमें नहीं बोलना है, पॉजिटिवली से ना, आई डू नॉट वांट टू फेल. ऐसा बोलेंगे तो हमारा एनर्जी फेल के तरफ ही जाएगा. इंस्टेड यू कैन से आई वांट टू पास, आई वांट टू विन, आई डू नॉट वांट टू बी sick, I do not want to get into COVID, I do not want to get into depression. Instead that you should say I want to be healthy. Simple बात है. I do not want a struggling job, मुझे टेंशन वाला जॉब नहीं चाहिए. So टेंशन के तरफ हमारा एनर्जी जाता है. Instead you can say I want a happy, I want an exciting job. तो सिंपल बात है. So these things daily if you practice ना, I'm not telling all those things. Mental illness is also like invisible. You can have anxiety but still you can sound confident. You can have depression but still you are smile, you can make jokes, you can feel suicidal but still turn up to work every day and appear fine. So the thing is what type of, so many things I have said, many things you also know, I can also learn from you. So some or other thing is definitely required for our daily living. any sort of things. Maybe daily agar subah utte aap gratitude de do for the day, for the last night, for the sleep. I'm not telling gratitude only the God. If the people is not believing in God, say thanks to anything you have, your bed, your nature or anything. So at least start practicing that on anything. So if not you, who? And if not now, when? So that is depression. Means any step of man, you should not feel. I may proudly say I am having diabetes, I am having heart disease, I am having, मेरा तो कोलेस्ट्रॉल बढ़ा हुआ है, मैं तो obese है, ये सब proudly हम बोलते हैं. लेकिन कितना लोग proudly ये बोलेंगे कि I am having mental illness, I am suffering with depression. So this stigma still it is there. The public health पे ये टॉपिक आना चाहिए. एक्चुअली पब्लिक मस्ट बी अवेयर अबाउट दिस थिंग्स की that stigmatization has to be avoided, because a sound body always exists in a sound, मतलब a sound mind is always existed in the sound body. So recently also I've seen some campaign somebody put in the social media. How many of you will join with me openly, couragefully, that I am suffering with depression, I am suffering with some anxiety, support me, like ऐसा करके. तो कुछ लोगों ने support किया. Yes, I can also say in front of me, I should not think what people are thinking about me. So this is the thing we can say. So it is a treatable condition and always help is available. So the thing is always try to equip with something which we can do. And definitely हम एंटी डिप्रेशन तक आने की जरूरत नहीं पड़ेगा. द एंटी डिप्रेशन तक नहीं आना है. बिफोर दैट इटसेल्फ वी कैन क्योर आवरसेल्व्स एंड वी कैन help others actually. So सबसे पहले we have to help ourselves, then only we can help others. So thank you once again, and I convey my greetings from here, and you all are welcome to Mount Abu. Also, it's a good place to visit, and have a nice time. And once again, my heartfelt appreciation to all the team, and especially the psychiatric department, doing great job. I can see in the Facebook, in the social media. I used to attend many classes, and people are really doing the best. And once again, thank you for giving me the opportunity.
Thank you, sir, for making this session a very interesting one and giving students examples and ways to deal with it. So that was really very much appreciable. The black dog concept will be something which everybody will remember and will look forward to make the black dog a friend rather than letting it engulf. Thank you so much for joining with us, sir. It was a great pleasure to have you. Thank you.
Thank
With
you.
this,
Thank you.
we also thank the PU webinar team. Thank you. We end this webinar here. Thank you.